Every part of the United Kingdom is now in lockdown.
It's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out.
Across the country as a whole, roughly 1 in 50 people have got the virus.
Professor Montgomery, thank you so much for giving us your time. We hear about a new strain of COVID and we look at the rates of infection in the UK, and of course it raises enormous concerns in people's minds. What can you tell us about this variant?
Right, so there have been a lot of variants since this first appeared, the coronavirus first appeared, because all viruses mutate. Early on, when the virus bust out of Wuhan, there was one genetic variant that made the virus just that little bit more transmissible. Not much, just a little. And that's the one that became very dominant. So it goes to show that you just need a little bit of a change to make a difference. Now, in this particular case, a whole bunch of mutations in the UK version have appeared at once. Rather than there being an incremental change, a new virus variant appeared with 17 different mutations in it. We're not quite sure how it appeared, but it looks as if it might have been cultivated in a person with an impaired immune system, who therefore would have had a low-grade immune system, low defense, chronic infection, allowing this virus to get multiple different mutations. And there are 3 mutations that are causing particular concern in this, all of which really increase the transmissibility of the virus, or 2 of them do, and the other helps the virus escape the body's immune system.
Just on that, transmissibility, what we're talking about here is something that is more contagious?
Correct. So around, estimates have been 50 and 70%, best guess is around 56% more transmissible. And whilst it doesn't appear to be much more virulent, i.e. you're not a lot sicker if you get it, so far we think, certainly one of the mutations does allow the virus to partly escape the body's immune system. And that might account for some slightly different demographics we're seeing here. So, for instance, we're seeing far more pregnant women being affected this time round than we did in the first wave.
Yeah, I was going to ask you about that and who it affects and where. And I also wanted to focus on how it is spreading in other parts of the world. We know that it's been detected here in Australia, particularly in quarantine hotels. So what about that spread, and what should countries like Australia be looking out for here?
Well, it's the same old disease is what you're going to see. And of course, this is very difficult to contain. We saw this with version 1 when it first came. Once it gets out, it's almost impossible. You can't put the genie back in the bottle. So heaven forbid that Australia gets hit as we are, but you'll just see another very big wave of very much what you saw before. Now, we're seeing a slightly different demographic hitting hospitals and intensive care, and that's partly in the United Kingdom because sadly a lot of elderly people in care homes have already died, some of the vulnerable, but also because there's a much better system of shielding, protecting and locking those people down. So we're seeing far more younger people, I suppose, middle-aged people, I suppose, I should say, because I would still like to count myself as young, but people younger than me, I'm 58, we've got plenty of people between their late 20s and their 50s in hospitals and intensive care now. The good news is you can avoid it by doing exactly what you did before. Masks, alcohol gel, and keeping social distancing and avoiding large gatherings really does still make it hard to catch this virus. So it just takes rigour, and more rigour than was applied before. Here's
a really important question, of course, given that we're seeing a rollout of vaccine. Does this impact on the vaccines that we're seeing now? Will these vaccines work equally against this new variant?
As far as we're aware, yes. So the vaccines themselves normally have gone for a combination of different proteins on the spike, this sort of receptor element to the virus. And as far as we're aware, the vaccine should be just as effective for this variant as it was for the previous ones.
And a final thought from you on just how this is being dealt with in the UK, because of course we're now talking about 1 in 50, I believe, people in the UK who now have COVID, and the lockdown, whether in fact the response has been quick enough from the government, and for countries like Australia, which thankfully have avoided the worst of it, what they may be able to learn.
In my view, we've locked down too late again. The playbook for infectious diseases from the World Health Organization for any contagious virus is to lock down early and lock down hard, because that's the way you suppress the viral transmission. And we didn't. In my view, we've left this too late. All of us working on the front line have seen this coming for weeks now. And the idea that we would let people and not forewarn them of the urgency of the situation has left this to run riot. And we really are in a terrible pickle now with hospitals in Great Britain. We're really very stretched, more so than we were first time. We've got 40% more patients in hospital now than we did at the peak of the first wave.
Yeah, good luck dealing with it. Thoughts are with you and everyone having to deal with this right now. I know you're very busy, so appreciate you sharing your time with us. Thank you.
My pleasure. Stay safe.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.